A two-day orthognathic surgery workshop was jointly organized by Department of Orthodontics and Dentofacial Orthopedics and Department of Oral and Maxillofacial Surgery (BPKIHS) on 28th and 29th August 2024. The two-day event mainly held at the HPE Hall of BPKIHS. In the first day included lectures regarding orthognathic surgery, treatment planning and orthognathic surgery, and on the second day the participants were divided into four groups and different cases were discussed about how to plan the orthognathic surgery and how to select the cases.
Usually gives you enough space. Worry about low incisors though is you've got to limit how far you can push them. You've got to think of the periodontium, the gingival response, and so sometimes you might need to extract to preserve that. In a class 3 with an increased face height, you do need to level the arch, because if you don't, you will increase the face height. So if your overbite is increased when you correct that surgically, it will increase the face height. Centre lines, that's really important. You want to get the middle of the upper in the middle of the face, and the middle of the lower in the middle of the chin. So you need to assess the
IV anesthesia. Why? Because our patient group, I mean I've got patients in their 60s having orthognathic surgery, but generally they're in their 20s. And actually the physiology in their 20s is pretty robust. The most thing is you struggle to keep that hypertensive anesthesia. There are lots of tricks they can do, the anesthesia, remifentanil, good magnesium infusions, there's all sorts of tricks they can do to drop the blood pressure for you.
Understand. So
your decompensation, are you extracting or not extracting?
yes. So according to the theory, obviously when we plan for the orthognathic surgery, so we have to extract at least 6 mm before the final date of the orthognathic surgery, the impacted molars. So we'll do extraction along with we'll ask
Let me clarify. What are you extracting?
extraction
What?
hard molars.
Third mothers will give you any space for it.
It will not affect the space. Not for the space, but while giving the bilateral surgical history osteotomy cards. So this may
that's a separate part. We can discuss wisdom teeth in a minute. There will probably be different views around the room as to whether you extract wisdom teeth and cover surgery or not, do them before. Sometimes I'll do them before, I think they're going to potentially cause a bad slip. Sometimes I'll do them after surgery. This is not part of your orthodontic plan, is it? So, in order to get this decompensation, in order to get this reverse overjet,
laser has a so many additional one to my own eyesight, 100 pieces of equipment I have there, and my juniors and medical staff are there. And the laser can escape it. Everything has to stage it.
Go ahead.
Then I got to know that probably there is so much to learn in orthognathic surgery. I was like a technician until then. He taught me all the technical aspects, but there was so much to learn. The course is there, it's really expensive. I thought that was one of the great ideas to have a course, something very similar in Nepal. To the best of my knowledge, this is the first of its kind that we are organizing something, especially with an intent to train the new generations from the very foundations of orthognathic surgery, about thinking about its planning and all that aspects. So I'm really thankful for making it happen. All the faculty, thank you for coming all over and helping us out with this. I would like to have some feedback for the faculties or for the course, so that in near future, if we plan something similar, if there are any improvements that we could incorporate, or I'm sure there would be some shortcomings from our side. So if there are any, please feel free to share it with us. So if there is anyone, anything, if you would like to share anything.
Can I finally overcome?
Thank you, resource person, sir, and Dr. Mehul and the whole team. It was a great learning. I learned a lot. I hope this kind of program is going to happen, and I think I'll be the first one to come again. Get registered. Thank you.
Thank you everyone. I'm very happy to get participate in such type of program, which is mainly based on all the aspects of the surgical planning, orthodontic, case selection, all the planning in a comprehensive test, like treatment based here. So I would like to say that when organizing such type of program, it is very essential that we have to take active participation, which I see here. So all everyone were actively participated along with our resource faculties, with all the participating team members. The things that I missed from my experience, like whenever there is a surgical planning, some may not have seen the instruments that are used during the surgical planning. So they may be required familiar with the specialized instruments that you are practicing in your country. Maybe you are not having such instrument here. So maybe the next time we can see such things here. Next, some moment we also like to see few small videos like how the things are happening. So maybe it will give more creative idea regarding the treatment plans. Thank you.
As Sean said, this was the first time here for most of us, so we had little or no idea whatsoever that we were getting into. But actually, you've all been, without exception, incredibly kind and generous to us. So I would like to extend a thank you, Sean, on behalf of all the others, a heartfelt thank you to all of you for making us all feel so welcome. You've given of your time, and we really, really do appreciate it. We hope you've got something from us. We're still around for a while, and it's been an absolute pleasure. Thank you.
If I'm not wrong, probably this is the first course that I think I know that the orthodontist and the maxillofacial surgeon have come together to do surgical planning. I have never, I don't know if anyone have ever had this kind of workshop done anywhere in Nepal. I think this is probably the first. So this might be something very interesting to all of us. And the other thing, it might sound a bit selfish, but usually the courses that I see organized by the British Association of Oral and Maxillofacial Surgeons in the internet, the number of participants are very limited. In one way, it helps because there was a huge number of participants, so it's very difficult for all the participants to actively engage and all, and it's very difficult for the research faculties to tackle each and all of us. But since this is the first of this event, we're not so adamant to reduce the number of participants. We would like to have as much as participants as we want. So that has to be worked on. If this kind of events start to happen a lot, so gradually we can reduce the number of participants and increase the number of frequency of such kind of works of the other resource faculties, regional and local resource faculties may learn something from this kind of event, so they can adapt this kind of workshops in different parts of our country. That would be a good initiative. I think that we could start from this program. And now to present the word of thanks and formally end this program, I would like to invite the organizing chairperson of this program, Dr. Anjali Kumar Yadav sir, from Department of Oral and Maxillofacial Surgery. Please can we have a huge round of applause for him. Thank you.
Good afternoon, one and all. On behalf of organizing team, I stand here before you today with the immense gratitude and joy as we came come to the close of this event. It has been 2 days filled with knowledge, insight, and none of this would have been possible without the quality of the First and foremost, I would like to extend my heartfelt thanks to our resource faculties who have traveled a long way from UK to share their insightful that has enlightened us and added great value to this event. Your experience, your knowledge has left us a lasting impression, and we are grateful to you for your time and effort. Thank you, sir. Thank you from my bottom heart. Thank you. Similarly, I would like to thank all the faculties, senior resident, junior resident, from both the Department of Oral and Maxillofacial Surgery and Department of Orthodontics, again for guiding me and their timeless effort and contribution to make this happen successful. A special thanks goes to our sponsors, whose generous contribution and support has been crucial in making this event success. To our house officers and volunteers and the helping staff from this HP hall, I cannot forget, and it is never less to thank to all the other participants who are actually the center of this event. Thank you all once again. Have a safe travel. Have a good day. Thank you all.
Thank you all.